Hey everyone, my name is Madeline Smith and I'm originally from Las Vegas, Nevada. I'm currently in Rexburg finishing up my third year here at school. And for this project, I'm going to be talking about the etiology of polio as well as its treatment, prevention, and control. Poliomyelitis is a viral disease caused by what is commonly known as the poliovirus. Now, the poliovirus is an RNA virus, which is part of the enterovirus genus of the Picornaviridae family. RNA just stands for ribonucleic acid, and RNA viruses have the capability to house genetic material like most other viruses. This Picornaviridae family of viruses are very common among mammals and birds. This family is actually the same family that causes other similar diseases like paralysis, meningitis, and hepatitis. The enterovirus genus umbrellas all viral diseases that are contagious via the upper respiratory tract or the gastrointestinal tract. The poliovirus has a single strand RNA core, which you unfortunately can't see in the picture, but it also has a large network of proteins, which you can see as the large bundle of blue and yellow, and this surrounds the RNA core. They call this the protein capsid. Now, this capsid does not have a lipid envelope, which means that the virus itself is resistant to lipid solvents. Throughout history, there have been many known cases of polio, but the first description of the disease came in about 1799 by Dr. Michael Underwood. Now, since then, there have been 3 known types of polio that every reported case falls under. The first type is referred to as subclinical. Now, this type makes up for approximately 90% of all polio cases, and most patients with this type experience no symptoms and have no problems with their central nervous system. The second type is called non-paralytic. This type does not result in full paralysis, but patients do suffer from some problems with their CNS, namely stiffness or pain in the limbs. The third type is referred to as paralytic, and it's the rarest but also the most severe form. This results in full or partial paralysis. And Jonas Salk's vaccine was announced in 1953, and it protects against all 3 strains of the poliovirus.
Reservoir, the polio virus.
Hello everyone, and my name is Indy Meekum. I'll be teaching a little bit about polio reservoirs. Unfortunately, the only known polio reservoir is humans.
Gasp! Yes, unfortunately, humans are the only known carriers of polio. Polio is transmitted most frequently by persons with inapparent infections. More about transmission later. There are no asymptomatic carrier states except in immune deficient people. Asymptomatic meaning a condition or a person showing no symptoms. Worldwide reservoirs. Polio is epidemic in Nigeria, Pakistan, and Afghanistan. The Peshawar region is critically infected by a paralytic wild strain of the polio virus in Pakistan, and is the only place in the world where this disease is on the rise, and is the largest reservoir of polio. 83 out of 91 cases in 2013 in the country are genetically linked to the polio virus circulating actively in Peshawar. Want to learn a little bit more about polio reservoirs? Here are the sources that I used to find my information.
Hi, my name is Katie Jackson. I am originally from Parker, Colorado. This is my 5th semester at BYU, Idaho. My first semester doing it online. I'm working towards the nursing program, probably apply to one here in Utah. And I'm going to be talking about signs and symptoms along with transmission in the polio virus. So as I said, I'm going to be talking about the signs and symptoms of polio. Something about polio is that lots of people who are infected, they may not realize they have the polio virus because they don't become sick of it or they're just not aware they have been affected. The signs and symptoms, we need to learn what they both mean. They're very different. And a sign is something that is objective and it is something as it is, and it is a signal that a disease or virus is there, while a symptom is subjective and is evidence from the patient that they give you that they're not feeling well or some particular part of their body is hurting or is uncomfortable. So first off, non-paralytic polio is something that does not lead to paralysis, and the symptoms are often flu-like, and they can last 1 to 10 days. For example, some of the signs and symptoms that are experienced with this is there's a fever, a sore throat, a headache, there's vomiting, fatigue, pain or stiffness in the body, muscle weakness, and tenderness, or there's meningitis. You can also be infected with paralytic polio, and there's many different types of paralytic polio. There's a spinal polio, which has to do with the spinal cord. There's bulbar polio that has to do with the brainstem, or there's bulbospinal polio, which has to do with both the brainstem and the spinal cord. You experience a loss of reflexes. You can have severe muscle aches or weakness. You can also experience loose and floppy limbs, or another possibility is that one side of your body could be worse than the other. That is not with every case, but that is something that can happen with paralytic polio. And these often happen really fast and they escalate quickly. So you don't feel very good very fast. Another thing that can happen is a post-polio syndrome, and that is something that affects people who have had polio already, and it can affect a person for a number of years. On average, they have found that it affects about 35 years after a person has had polio, and it's very progressive. And some signs and symptoms they can have of that is there's a progressive muscle or joint weakness and pain. There's a general fatigue and exhaustion after very little activity. There's muscle atrophy, which is where your arms or your legs or whatever is affected from the polio gets really small because of the lack of activity that has been done. There's breathing or swallowing problems that can happen. There can be a sleep-related breathing disorder, such as sleep apnea, where you can stop breathing for a short period of time while you are sleeping. There's a decreased tolerance for cold temperatures. There are some cognitive problems where people have a hard time concentrating and they may have a hard time with their memory. And also there can be depression and some mood swings. Franklin D. Roosevelt was a president of the United States, and he did have polio. He was affected in August 1921, and his signs and symptoms are really interesting to see how it affected him and how it eventually affected him for the rest of his life. He ended up being paralyzed from the waist down for the rest of his life, and that was really hard for him. But some signs and symptoms that occurred to him when he was infected was he had a fever. He had ascending paralysis of upper and lower extremities. He had facial paralysis. He had bowel and bladder dysfunction, and he had numbness and hypersensitivity of the skin. While he experienced all of these things, they eventually evolved and they went away, and he was just left paralyzed from the waist down. Last, we're going to talk about transmission, and most commonly, poliovirus is spread through fecal-oral route, and that is where there's fecal matter wherever, and somebody could be touching that and they don't wash their hands, and it can eventually just touch their mouth or touch food that they're eating, and they can be infected with a disease or a virus. In this case, it could be a polio virus that is in what they're touching. But in cleaner environments where there's not too much fecal matter around, it's commonly spread oral to oral route. The poliovirus, it multiplies in the intestines, and as it multiplies there, it is eventually spread to the feces. But once a person has been infected for around 1 month, that is when the poliovirus is excreted through the feces. And so that is how it can be transmitted to other people, and that is why it's important to wash your hands.
Unfortunately, there is still no known cure for polio. The treatment for the disease, however, has come a long way since its discovery. The main goal with treatment is to increase patients' comfort and to prevent any further complications. Some of the treatments include bed rest, a nutritious diet, pain relievers, and moderate exercise, normally in the form of physical therapy. Physical therapy helps to prevent muscles from losing their function, as well as keeping the body resistant to other deformities. The poliomyelitis vaccine is successful in preventing all strains and types of polio. The most efficient way to ensure that you are fully immunized is to get a series of 4 vaccines at different stages of life. Doctors recommend receiving the immunization at 2 months old, 4 months old, then at 6 to 18 months old, then one final time between the ages of 4 and 6 when children are getting ready to enter school. After the first 2 vaccines, there is a 90% effectiveness rate, but after all 4, that effectiveness rate goes up to 99%. Since the virus has the capability of being spread through fecal matter, another way to prevent the spread of the disease is by frequent hand washing, especially after using the restroom. Everyday, healthy habits like covering your mouth when you sneeze or cough also assist in the prevention and spread of polio.
Hello, my name is Elizabeth Alt. I'm from Mechanicsville, Virginia, and I'm finishing up my last few prerequisites before I start nursing school in January. And today I'll be sharing with you some additional information about polio.
While we don't know when the polio virus first started affecting humans, we do have evidence that dates back to 1400 BC indicating that Egyptians suffered from polio. More currently, in the late 1700s, the clinical features of the disease were first described, and outbreaks began in the late 1800s, moving to epidemics in the early 1900s. The epidemic of 1916 had disastrous results. There were over 27,000 cases nationwide and 6,000 deaths. 2,300 of those deaths were in New York City alone. In 1921, Franklin Delano Roosevelt contracted polio at the age of 39. His example had major impact on public perceptions of individuals with disabilities. Although he was open about having polio, he concealed the extent of his disability. In 1935, a killed polio vaccine was prepared and tested on chimpanzees and children. Unfortunately, out of the 10,000 children, several subjects died of polio, many were paralyzed, made ill, or suffered allergic reactions to the vaccine. Then, in 1947, Dr. Jonas Salk was recruited and received grants to start a polio typing project. In 1953, Salk and his associates developed a potentially safe injected polio vaccine. Nearly 2 million children participated in the field trials, and news of the success was announced in 1955 on the 10th anniversary of Franklin Delano Roosevelt's death. By 1955 to 1957, incidence of polio in the U.S. falls by 85 to 90%. And the last cases of wild or naturally occurring polio in the U.S. were in 1979 in 4 states among Amish residents who had refused vaccination. In 1981, the polio virus genome sequence was published, and in 1999, inactivated polio vaccine replaces oral polio vaccine as a recommended method of polio immunization in the United States. While polio has been eradicated in the United States, unfortunately there are still 3 countries which have never stopped the transmission of polio: Afghanistan, Nigeria, and Pakistan. And we have to remember that polio anywhere is a threat to children everywhere. Luckily, there are programs like the Global Polio Eradication Initiative that are doing all they can to vaccinate, educate, and eradicate polio. As recently as 2008, 798 children were paralyzed by polio in Nigeria. There is a solution to ending polio. The oral polio vaccine is safe and effective and has successfully stopped polio in over 190 countries. Every child under 5 years old must be vaccinated to build population immunity. Each and every village in Nigeria has to be accurately mapped to show all households, and teams must be trained to vaccinate around 41 million children under 5 years old. Parents have to be educated. Politicians and lawmakers must support the vaccine campaigns. The Global Polio Eradication Initiative is doing everything they can to help prevent any more unnecessary deaths or paralyzations from polio. So take a moment to think about how lucky you are to have the full use of your arms and legs, and put your hand up for polio eradication.